Hello everyone, I am Dr. Tabassum Dalla. I am from Raipur and today I am here at 115 batch hands-on. Today we are going to learn about IUIs overall. Now the patient has already come to you and the follicle has ruptured. You have seen her follicular study done and the follicle is ruptured. Now what all will you need for an IUI once the IUI is already planned? So you tell the husband that you need to collect the sample in this sample collection box, a container, and you have to explain him how to do it properly. Then next, after you get the sample, the wash sample is, if this is the wash sample, which is been given by your embryologist to you, or you have only done it and you have got this now in a conical tube. So there are two methods. They can either load it in the IUI cannula and give you, or they can also give you directly in a conical tubes. So what you have to, ideally what should happen is he should give you in a conical tube and then you must load it from the IUI cannula. You take one IUI cannula and this is the cannula. You have to connect your syringe in that IUI cannula. The syringe can be of two types. There can be a lower lock syringe, but you can also have a simple syringe that you can connect like this here and open this. And there should not be any air here because we don't want any dead space. So you should directly go inside. Just be careful that don't touch the walls to avoid contamination. Go directly inside and then take the sample. How much sample needs to be taken? 0.3 to 0.5 ml. So you load it once and then lay the patient is already laid in the lithotomy position, and then slowly you have to inject it. So you have to use either sim speculum or Cosco speculum, and then you have to slowly go inside, and over a period of 1 minute you have to slowly inject the instill the semen, the washed sample in the uterine cavity. Thank you.
One question.
Yes, please.
Okay. Hi, I'm Dr. Srishti. So, in case if there is cervical mild stenosis, like we cannot, we are pushing it, but we cannot.
You mean you are
further.
finding difficulty when you are going inside. So you should find out the reason why this is happening. There can either be a retroverted uterus or acutely anteverted uterus. If it is an acutely anteverted uterus, you should partially fill the bladder and then you attempt again, and then it will be possible. Next, if you are still finding difficulty, then you can use, there are possibility of rigid cannulas are there. Rigid cannulas you pass inside and then you can do it. Next time when you have the problem, what you can do is, when you're doing ultrasound, you look at her uterocervical canal orientation and always draw it on your paper so that you can later on in the next, her next cycle, you can follow that route and then you can find that out.
Ma'am, after reaching inside, after negotiating the cervix, how much inside do we need to go with the cannula?
You should ideally just pass the internal os, and you should avoid touching the fundus because that can cause spasm, and that can, the procedure can, there can be a problem in the procedure. So you should just negotiate just inside the internal os.
Okay, thank you, ma'am.
So this is Dr. Aditi. I wanted to ask you, ma'am, to avoid the spasm, is there a method or something which we can do while preparing the sample?
See, if our sample is well prepared, then there won't be any ROS and prostaglandins, then the spasm will not happen. So if the sample is well prepared, and ideally I would suggest that you prepare your own samples instead of calling someone to prepare the samples.
But is there a way of specific loading of the sample that is required to avoid such spasm?
So that's why the dead space should not be. I mean, you should be very careful about the dead space, and you should avoid touching the fundus.
And proper washing.
Washing.
See, I tell you a simple thing. I need to record this. How do we make out that sample is properly prepared? How do we come to it? You will have मैं बैठ के बात कर लूँ? If you permit me. आप खड़े रहो. So the point is that once we prepare a semen sample, how do we know sample has come out clean? How do we come to know? What is the most harmful thing in a semen sample which we have to remove? Prostaglandins. What else? ROS. What else? Debris. WBCs. What else? See, these all things can be removed easily. What troubles us is something called zinc. When you have high amount of citric acid, zinc in which is not required. So marker of a proper semen preparation is by looking at the amount of zinc in it. Once you prepare a semen sample properly, it should have minimal zinc concentration. So in case you look at the best method of preparation becomes double density because there is no zinc coming up there. It's given in WHO manual, you can read from there. So what she said was washing the sample, and when you create an interface, and where is the interface formed?
45 and
90.
Density.
So 90 नीचे 45 ऊपर ऐसे ही होता है ना. When you make an interface, we trap everything there. So we are trapping one trap we have it at the level of 45 on the top. What does that trap? That will trap. That's basically superface. That is superface. That will take out all those dead sperms. It will take out WBCs, pus cells, but the toxins and other things will pass through the 45 and they get stuck at the interface, that is 90 and 45. So interface will take out sperms which are actually not very motile. So non-NP sperms will be separating at interface along with all these toxic material. And superface, the top phase will remove immotile sperms and WBCs. So in case now how do we remove that? So in case we remove 90-40 properly and we resuspend the pellet properly and wash it in around 2 to 3 ml of pedia, spin it. Once we spin it, what will happen? We will get the pellet, we remove the supernatant, and then in case we take one proper swim up, then it will go off. Now, this happens double density. But in a routine wash up, what people do, they will spin, they will remove the supernatant, and same pellet they will have a swim up. Now remember that the tube is coated with the prostaglandins all around. So whenever you get a pellet, shift the pellet to the another tube. And when you shift the pellet to another tube, you pick up only the pellet. Some people, when they are doing pipetting, they break the pellet. So all the prostaglandins will come inside. So when you remove all the supernatant, make the pellet totally dry. And then in the new pipette, you take 1 drop of media, fresh media, and then break the pellet and take it out. That's the way you will avoid getting prostaglandins being transmitted. And prostaglandins we don't check, we check zinc. अगर zinc कम है तो prostaglandins भी नहीं होंगे. Large number of people are doing nascent sample insemination. Are you aware of that? अभी भी करते हैं लोग. They take the sample and they just prepare it with a scalp pain set or the feeding cannula. Such a practice should not be done.
Is it true the prostaglandins are settled at the periphery of the tube?
They will
So
coat.
we need to remove that first.
No. You don't go into that nitty-gritties.
Yesterday
No.
he told yesterday.
I'm just saying, you want to eradicate prostaglandins, so don't take them. Eradicate. What will coat the tube? What will coat the tube? The dead sperms, pus cells, toxins, prostaglandins. They will coat the tube, no? तो मैंने क्या बोला है आपको, दिमाग मत लगाना, सिर्फ सुपरनेटेंट को पूरा निकाल देना, एक सफ़ेद रंग का पैलेट बचेगा. उस पैलेट को उठाने के लिए some people what they do is that they leave some amount of supernatant over that pellet, उसी में तोड़ते हैं, वो मत करना. So take that pipette inside with some media. Take a pipette with some media, and then you just go to the pellet and उसी के साथ हल्का सा दबा के pellet को तोड़ो. And that pellet should be taken up as dry as, don't dry it, but as nude as possible, without any supernatant. And when your pipette is going inside, the pipette should never touch the walls of that will give you all the prostaglandins. A simple way of doing it. See, we are doctors. This is all what is required. So once you pick up this pellet from there, pick up the pellet in 2 ml or 3 ml of a media in a fresh tube. And then you change the pipette. गलती क्या करते हैं हम एक ही पिपेट के साथ काम करते रहते हैं. So we think that that pipette we are using for every procedure, but that is giving you prostaglandins and zinc. So pipette change karo, that is more important. And in case you have less amount of pipettes, you fall short of a pipette, then you have some around 1 ml of media is there in their pipette. Just take few drops and rinse that pipette again. Have I given the right answer or are you still confused?
No, sir.
What was told yesterday, by the way?
Prostaglandin will coat.
From the periphery. That is the reason I asked her this question. That is the reason I asked her this
क्या
question.
सवाल था आपका?
The fact that he said that this causes a spasm, so we need to remove the prostaglandin, and the prostaglandin are settled near the periphery of the tube. So first, what you do is you take the pipette and you remove the circumferential fluid first.
कभी भी नहीं हो सकता, because see your tubes are in your hand. Tube is in your hand, no? It's already everything is swirling inside.
When he was doing, he was showing us
Like this,
side say he was removing. So it was his technique to remove. Anyway, he have to remove only.
You
so
have
it
to
doesn't
remove
matter,
only.
I
You
think.
have to remove only.
Yeah.
See, it
he
will.
was doing like this movement.
No.
The fact that it caught my attention was because most of the patients have spasm in IUI post procedure. Sometimes I've noticed.
I've never seen that.
I have.
So this means that your person is not doing the thing properly.
Okay.
And basic thing is change the pipette, and when you resuspend the pellet, don't take it in supernatant. Take it in the one drop of media and never just take that pellet freely in the new tube. And there you don't spray 2 ml on the cervix. Use 2 ml for washing.
Wash media there.
Your person is doing by double.
The new, that's 2 pipettes you need.
And
First is done and
the